Hello and welcome to this online lecture on spinal injuries hosted by Paramedical Services. The contents of this lecture include some epidemiology and statistics regarding spinal cord injuries, anatomy and physiology of the spine and vertebral canals, the mechanism of injury associated with spinal injuries, the signs and symptoms, and the pre-hospital management. Every year around the world, between 250,000 and 500,000 people suffer a spinal cord injury. The incidence of spinal cord injury are 4 times higher for males than that of females. 79% of all cases of spinal cord injuries are a result of trauma, and of these, 46% are transport-related. Under the subsection of transport-related injuries, 79% were motorcyclists. This is quite an understandable statistic, being as though motorcyclists are relatively unprotected versus motor car drivers and are at higher risk of injury. 28% of overall cases of spinal cord injuries were a result of falls, and 64% of those were a result of a fall from over 1 meter high. 11% of spinal cord injuries occurred at work, and 44% of those were related to transport incidents. Population groups most at risk are the 20 to 40-year-olds, and then there's also an increase in spinal cord injuries above the age of 70-year-old due to falls. Spinal cord injuries have a debilitating effect on the patient. These effects can either be short-term or permanent. Patients with spinal cord injuries have an average stay of 133 days in hospital, and it costs the healthcare system millions per annum in the management and rehabilitation of patients with spinal cord injuries. These statistics were all extracted from Spinal Cord Injuries Australia, which is a non-profit organisation which aids in awareness and management of spinal cord injuries here in Australia. The spinal cord is housed and protected by the vertebral column. The vertebral column extends from the base of the skull all the way down to the pelvis and consists of 33 vertebrae, 9 of which are fused together to form the sacrum and the coccyx. These are immovable and solid, whereas the rest of the vertebrae all allow for a small degree of motion and movement that, when working together, allow for the flexion and extension, bending and twisting that can be achieved through movement and motion of the spinal column. The vertebral column is divided into 5 different regions due to the shape, function and structure of the vertebra in each region. Starting from the bottom and working our way up, there are 4 fused vertebrae that make up the coccyx right at the base of the vertebral column. Then there are 5 fused vertebrae that create the sacrum. The sacrum forms part of the pelvic ring and articulates with the pelvic bones. Superior to that are 5 lumbar vertebrae. They're quite large and dense in their structure, as they are required to support more of the body weight than the thoracic or cervical vertebra. Superior to the lumbar vertebra, there are 12 thoracic vertebrae, all which articulate with a rib to aid in forming the thoracic cavity. And superior to that is the 7 cervical vertebrae, which allow for the range of motion we can achieve in our neck. The cervical vertebra, as it's the least supported vertebra in the body, is the most susceptible to injuries. And in fact, more than half of spinal cord injuries occur as a result of a cervical injury. The spinal cord is an extension of nervous tissue from the brain, and it's responsible for conducting impulses to and from the brain and the different body regions. The spinal cord extends all the way down to approximately 1st and 2nd lumbar vertebra, and then extending down from there are just pairs of nerves branching out through the vertebra to the lower portions of the body. The spinal cord and the brain are surrounded and protected by the meninges and cerebral spinal fluid, which is in constant circulation around the brain and spinal cord. The spinal cord lays within the vertebral canal on the posterior portion of the vertebra. So if we have a look at the diagram on the bottom of the page, the vertebral body that we see over here is on the interior portion or anterior portion of the person's body, whereas the spinal canal in which the spinal cord lays within is on the posterior portion where the spinous processes are. You can actually feel down the spinal processes to be able to count vertebra, which help to locate the site of an injury. Between each vertebra is a spongy disc which acts as a shock absorber and a separator between each of the vertebra, and it's at the point of these gaps between the vertebra where there's an extension of two nerve bundles which leave the spinal cord and supply nervous tissue to the different regions of the body. There are 33 pairs of spinal nerves, each leaving the vertebra, and they're named after the vertebra in which they extend out of. There are 8 cervical spinal nerve pairs, and that's because the first pair of cervical nerves actually extend out from the occipital bone. And then there are 12 thoracic spinal nerve pairs, 5 lumbar spinal nerve pairs, 5 sacral spinal nerve pairs, and 1 coccygeal spinal nerve pair. These nerve bundles or nerve pairs are responsible for distributing nervous tissue to different regions of the body, carrying sensory, motor, and autonomic signals. They're arranged in such an order that it can actually be mapped out on the body in something that's called dermatomes. And if we have a look at the diagram on the right-hand side, we can see the order in which these pairs of nerves extend out and feed certain regions of the body, forming these dermatomes. Dermatomes can be particularly helpful in spinal cord injuries where people have either had loss of sensation or motor function in particular areas, and as this can help to indicate which part of the spine has been damaged or at which level the spine has been damaged, that there's no longer transmission of signals to and from the areas of the skin. So, for example, if we were to come across a patient who had lost sensation in their left and their right thumbs, it would be safe to say that there was an injury around the C6 vertebra because the C6 nerves have been damaged as they feed the thumb and the forefinger on either side of the body. Whereas if a patient lost sensation or function of their middle finger, that would be related to a C7 injury. Or if a patient had lost all sensation below their nipple line, that it would be an injury associated with the 4th thoracic vertebra. The dermatomes are very helpful in assessing your patient, particularly when they have any neurological deficits. It is quite a difficult map to try and remember. However, if you pick a few key dermatomes to commit to memory, this can drastically help with your assessment of your patient. Some important and recommended dermatomes to remember are C6, which is the thumb and the forefinger on either side, C7, the middle finger on either side, and C8, which is the 4th and 5th finger on either side. T4 is approximately the nipple line, and T9 or 10 is approximately the level of the umbilicus. C3, which is the front and back of the neck, and C2, the back of the head. Moving on to some of the common causes of spinal trauma. The majority of spinal trauma is a result of blunt trauma relating to things such as motor vehicle accidents, motorbike or motorcycle accidents, MVA pedestrians, shallow water diving accidents, falls from a height, sports injuries, recreational activities, and then assault from blunt and penetrating traumas. The common mechanism involved in injuries with the spinal cord or the spinal canal have to do with hypoflexion and extension. The This is generally a result of that acceleration, deceleration injury, which can result from motor vehicle accidents, falls from a height, and any incidents where there has been a significant blow to the head. These type of injuries can cause tearing of ligaments and instability, leading to things